All right. Good afternoon, everybody. This is Shay Raybold with Kentucky Housing Corporation. Everybody should be muted, but actually I'm going to push the mute all button, but if you could just make sure you're muted unless you have a question. And I know we had well over 100 people register. So we'll give folks just a few more minutes to log on and then we'll get started. While we're waiting in the chat, I'm going to post a link to the K-Count page of our website where we will be posting these slides as well as a recording and other information very soon, but we'll probably refer to the K-Count page several times, or I know we will, I should say. And so this will be your link for you to make things a little bit easier. Of course, you can always just Google K-Count and you should be able to find this page pretty quickly, hopefully. Okay, so let's wait 2 more minutes and then we'll get started. Let's see, Monica. I was getting ready to verbally answer you, but you say you can't hear us, which means you can't hear me. So I'm going to type it for everybody else that's wondering what I'm doing. Try logging off and back on. Kayla Sexton, my colleague at KHC. Can you hear me okay? You can type in the chat or unmute yourself.
Hey, Shay. Yeah, I can hear you.
Okay, super. Thank you.
You're welcome.
Okay, and Sarah, are you able to see my blue PowerPoint slide?
Yes, Shay, I can.
Okay. Well, then I think we'll go ahead and get started. Again, my name is Shay Raybold with Kentucky Housing Corporation. And I do have several of my KHC colleagues on the call, I believe. And I welcome all of them to unmute themselves if needed to chime in at any point. But I am going to be joined for sure in this presentation by Sarah Morris from our HMIS team. She will be helping go through these slides today. So I appreciate her help. And I want to thank everyone for being here. I know this is a busy time. It seems like it's always a busy time, but certainly getting things going after the first of the year is always busy. And asking you all to help with the K-Count is just one more thing. So we certainly do appreciate you. If you attended one of the in-person K-Count trainings, this content will be almost identical to what we did at those trainings. You're welcome to stay and join this one as well, but I just wanted to give you a heads up that this is essentially the same training that we did in person. There will be a recording, as I mentioned earlier, and we will make that available on our K-Count website, and that link should be in the chat. I'll drop it in a little bit later too to make it easier for folks to find. And we will link to it in tomorrow's KHC Homeless and Support Services eGram. So if you get those, you should get the link to the recording. So without further ado, I am going to actually stop sharing my camera so I don't distract myself while I'm talking. But I'm going to begin the presentation and get through several slides, and then I will turn it over to Sarah. And feel free as I'm going to type any questions you have in the chat, and Sarah will either stop me as we're going, or I will get to those when we switch off and Sarah takes over, and then I'll try to answer those in the chat. Okay, so turning my camera off. All right, well, get my slide to advance here. So just a quick overview of what we're going to be talking about today. We are going to go over a basic summary of what the K count is. And the reason we do that is we always have lots of folks who this is the first time they've participated in the K count. And we want to make sure everybody's on the same page. And it's always a good idea to remind ourselves what the K count is for. And then we will discuss the minimum HUD reporting requirements so you can understand why we ask some of the questions that we do. We will spend most of our time talking about the data collection process, specifically the Counting Us method that we will use through a mobile app. And we will spend most of our time actually going through the survey itself, the questions and how to use the app. And then you can share that information with any other folks you have that might be using Counting Us a week from tomorrow on January 28th for the K count. And then we'll also share some tips from the field for any of you all who will be doing the unsheltered count. And then I'll mention just a little bit about the housing inventory count, and then we'll have some time for questions and answers as well. So let's just jump in and talk about what is the K count. First, I want to remind everyone or tell everyone that we will be using possibly some different terms that all mean the same thing. So the K count is the same as saying the point in time count or the PIT count. Those terms can be used interchangeably. The point in time or the PIT count is what the U.S. Department of Housing and Urban Development, or HUD, refers to this count as. And in Kentucky, we rebranded specifically the balance of state count, the 118 counties outside of Jefferson and Fayette, as the K count. And while we're doing the K count, there are communities across the entire country, 400 other continuums of care comprising thousands and thousands of communities across the country will be doing their own point-in-time counts. In fact, HUD requires that communities conduct a point-in-time count over one 24-hour period during one 24-hour date during the last 10 days of January. And the purpose of the K count or the point-in-time count in these other communities is to determine the size and scope of homelessness on any given night. And specifically for us, it is a snapshot or an estimate, if you will, of a specific subset of homelessness in the Kentucky balance of state. And I use that term very specifically, subset of homelessness, because the K count, as well as the point-in-time count nationally, only includes a certain group of people experiencing what's called literal homelessness. And there's an actual definition for that, according to HUD, which many of you may be familiar with. But just to remind everybody that the definition of literal homelessness, actually it's a subset of literal homelessness itself, are people who are unsheltered or sleeping in emergency shelters or transitional housing programs where the primary purpose is to serve people experiencing homelessness. So to restate that, we're interested in a subset of homelessness known as literal homelessness, but we're actually interested in a subset of literal homelessness because there's other categories of that as well. But essentially, those who are sleeping outside or those who are in emergency shelters or transitional housing programs where the primary purpose is to serve people who are homeless. And I'll elaborate on that in just a moment. So in addition to where you are sleeping, the other most important factor is what night you are sleeping there. And specifically, what we are interested in is where is the person sleeping on the night of Wednesday, January 28th, 2026, the last Wednesday of January. And except for in 2021 during the pandemic, when we held the point-in-time count, the K count in February, we have historically held our point in time count on the last Wednesday of January. So at least well over a decade, except for 2021. As long as I've been at KHC, it's been the last Wednesday of January. And unless something happens, which is not likely, next year it'll be the last Wednesday of January as well. So you can go ahead and mark your calendars for that. So I mentioned people being included who are sheltered. I want to elaborate on what that means a little bit more. So sheltered means people who are in year-round emergency shelters, or another way to say that are shelters that are open all year long. But also included are folks staying in shelters that are only open during specific months. So those might be referred to as seasonal shelters. We have those that pop up around the state, particularly in the winter months. Also included are those that are might be considered white flag shelters or warming shelters that open only when the temperature drops below a certain degree. So they might not be open all of the months of the winter, but they are open when it gets cold enough. So just want to make sure everybody knows those are included too. You don't have to be open year round to be included. Only open year round to be included. And then another area that gets a little confusing for people, but we want to make sure these folks are included. If people are staying in hotels or motels that are being paid for by nonprofits, charitable organizations, churches, or the government, essentially public funds or charitable nonprofit funds, then those people are actually considered as being in a type of an emergency shelter, and therefore they are included. And then people staying in transitional housing programs where the primary purpose is to serve people experiencing homelessness. And then, of course, those who are unsheltered, those are folks who are sleeping outside, on the streets, in a car, post office lobby, abandoned building, tent. It can be public or private property. So long as it's a place that's not meant for regular human habitation, then those folks would be considered unsheltered and would be included. So I want to speak briefly about who would not be included. We do have folks that are being served by homeless service providers, and perhaps they had to be homeless as part of eligibility criteria for the program they're in now. But because they're not literally homeless on the night of the count, they're not included in the K count. And those would be people staying in permanent supportive housing programs, whether it be HUD funded or not. And an example would be HUD VASH, which is also part of the VA, and then Continuum of Care, PSH. Those are not included in the K count. People that are staying in projects, and some of them might be considered transitional housing, but the beds are not dedicated to people who are homeless, then they are not included. And an example of that would be a substance use recovery program, such as Recovery Kentucky programs, where you don't have to be homeless in order to get into the program. You may be homeless at entry, but if homelessness is not part of the eligibility criteria, that project is not meant specifically for people experiencing homelessness, and therefore the people staying there are not included in the count because many of them aren't actually literally homeless. People staying in housing they own or rent, including those assisted with government funding, including COC or ESG or SSPF rapid rehousing. If they are housed on the night of the count, they are not included. People that are staying in hotels or motels that they're paying for on their own with their own funds or funds given to them by family or friends, while they might consider themselves to be homeless, and they might be under certain definitions, for purposes of the K count, they are not included. People who are doubled up or couch surfing, again, some might consider themselves to be homeless because they don't have a place of their own but they are housed in a place meant for human habitation on the night of the count. And it's not a shelter, and therefore they are not considered literally homeless. And then people in institutions, jails, foster care, hospitals, detox centers, they are not included either. If anyone has any questions about who is included and who's not included, please ask today or reach out to me or any of my colleagues, and we can talk about the circumstances and make sure we're on the same page. So when we get to the survey questions, the vast majority of the questions that we ask are asked because we have to report information to HUD. There are some questions that we ask that are used to make sure we're not counting people twice, such as asking for people's first names or initials or birth dates. That type of personal information is not shared with HUD. We share all information in a aggregated manner, meaning we add everything up together and submit it basically as a summary of everyone's responses. But the vast majority of the questions feed into what we have to report to HUD. And we will be telling HUD how many different households there were and how many of each household type, of which there are 3. Households with children, so that would be with children and adults. Households without children, another way of saying that is households with only adults, 1 or more. And then households with only children, which would be unaccompanied minors under the age of 17 without an adult. For the people that are included in households, we will be reporting, of course, how many people. So there will be a total number, and of the total number of people, we have to report certain demographic information. And this year, we know for sure that that will include an age range for every person and a race and ethnicity for every person. We also will report the number of parenting youth, unaccompanied youth, chronically homeless, number of veterans, and the number of people with certain disabilities or disorders. And the good news is that you don't have to know the definition for any of these, particularly parenting youth, unaccompanied youth, chronically homeless. You just ask the questions, and then on the back end, depending on how they respond, KHC is able to sort out who falls in which category and how many. But I did just want you to understand kind of what we report to HUD, because it helps understand or helps explain why we ask some of our questions, particularly the chronically homeless questions that Sarah will go through. It's about length of time homeless and number of times homeless, as well as whether you have certain disabilities and if that impacts your ability to live independently. And they can get kind of wordy and clunky, but depending on how people respond to them informs whether or not they would potentially meet the definition of chronically homeless. So in terms of the data collection method, there are 2 methods. And the first method is can be used by emergency shelters and transitional housing projects, and specifically those that use the Kentucky Homeless Management Information System, also referred to as KYHMIS or just HMIS. So if your shelter or transitional housing project regularly uses HMIS to enter your client level information on a regular basis, then you will be using HMIS and you will not be doing the one-on-one survey using the Counting Us app. And in fact, we held a very brief webinar last Thursday to go over the instructions for what HMIS, ES, and TH projects need to be doing. And that webinar has been placed in the Learn Upon system, which HMIS users should be familiar with. There will be a link to that information in tomorrow's eGram, as well as we'll get it posted on our webpage. Or if you're an HMIS Learn Upon user already, I believe you can search the catalog and find that. But just as simple, you could go to our K-Count page of our website, look under KYHMIS instructions, and find the information you need there. The second method is going to be used by those of you all conducting the unsheltered count. So people sleeping outside, other places not meant for human habitation, as well as those shelters and transitional housing projects that don't use HMIS. So that method requires you to ask questions of the person that you are speaking with. We call them one-on-one surveys, meaning one person conducting the survey, one person answering the questions, and you will use the Counting Us app to conduct those surveys. And then we'll explain in a little more detail about how to do that. So I just went over some of this information for HMIS users, but I'll actually there's a few more details. This information is on our K-Count page now. Instructions on what you need to do. But basically, just to reiterate, you're not doing the Counting Us app. We don't want you to duplicate your efforts and do more work than you need to do. You will be submitting a CAPR or an APR report. That's basically the same report. It just has a different name depending on your funding source you're used to. You will generate that out of HMIS and you will email it to the email address that's on the screen. And then you do have to do a K-Count sub-assessment directly in HMIS for every person staying in your project on the night of the count. That is not the same thing as Counting Us. That is a separate, much briefer sub-assessment to capture just a few questions that you don't ask on a regular basis. And the instructions for everything I just said, as well as an optional form you can print out for the sub-assessment and collect on paper and then report in HMIS later. Both of those are on our K-Count webpage. So for those of you all who don't use HMIS for your shelter or your TH project, you will be using Counting Us. This is the same method we've used for several years now. So if you've done it before, it's basically the same thing as we have done in the past. If this is your first time, it's pretty user-friendly. So we hope that you'll find it easy to use. You can complete the surveys directly in the Counting Us app. Just like other apps you've used on your phone, you can ask the person questions and whatever their response is, record the appropriate response. I'm sure you're familiar with filling out surveys yourself on your phone. It's totally the same thing. You can do it in what we call real time, which means as you're using the app in your phone, or you can actually use the desktop version of Counting Us. So your laptop, your computer on your desk. There's a way to do it there that looks the same. And then we also have paper copies, paper forms of the surveys that you can print out and put on an old-fashioned clipboard, conduct the surveys that way, but then you have to go back into Counting Us after you're done and enter the responses in order for KHC to get the responses. And if everybody could make sure they're on mute, please, just to make sure. Thank you. Okay, an unsheltered count, this is just the same information I just said, but it's just to reiterate that the unsheltered count has one method to collect, and it's to do the one-on-one surveys in Counting Us. You will not be using HMIS. You can do the unsheltered count in real time using Counting Us on your phone or on the desktop. And then we also have paper copies of the unsheltered surveys. We are not printing those out for you, but you can get them on our website. Those will be posted either later today or no later than tomorrow. And you can pull those down, have people fill out the information as you're talking to them. You fill out the information and then enter it back in order for us to get it. And then let's talk a little bit about when the unsheltered count can be done. So what we say as a best practice is that we want you to do it as late as possible. Starting on Wednesday, January 28th, which is the official K count date, through the evening of Friday, January 30th. Well, actually, the best practice, I should say, is to do it. Let me make sure I'm clarifying what I'm trying to say here. The best practice is to do it as late as possible on the 28th until the early morning hours of the 29th. So you are actually engaging with people where they are sleeping on the 28th, because that's what we want people to be able, we want to be able to capture people where they are sleeping. However, we do allow people to count through January 30th. But that is to be done in limited circumstances where you might not be able to cover an entire geographic area in just one night. You might cover lots of counties and it's difficult to get everywhere. In those circumstances, you can keep counting on that next Thursday or Friday the 30th, so long as you're asking people where they stayed on the night of the 28th. And then the observation method, which I think I might speak about a little bit more on the next slide, if I'm correct. The observation method is when you are not able to ask the person questions because they either have declined to participate or they are asleep. We don't want you to wake them up, or for some other reason, such as you have determined it might not be safe to approach the person, etc. Then you can use observation, which is literally you are making assumptions about what you're seeing with your own eyes. And in that circumstance, you can only collect minimal information, which is something we don't want. We'd rather you have the chance to talk to the person, confirm their living situation, and ask them additional questions. But the observation method, because you're making assumptions about where the person's sleeping, you can only do that during the night of the 28th until the very early morning of the 29th. So I hope that makes sense to everybody. So if you're doing the count and you're talking to people on the night of the 28th, you're going to ask people, where are you sleeping tonight? And if it's the next day, you're going to ask where they slept last night. And if it's Friday, you're going to ask them where they slept on Wednesday night. And so you want to make sure you and they are on the same page, that you're talking about Wednesday, the 28th. So I already mentioned all this. This is just reiterating the unsheltered observation form, which is also available in the Counting Us app. And there will be a hard copy or a paper copy as well on our website. Basically, you can do it in real time on your Counting Us app, just like the other surveys, or you can use the paper copy and enter it after the fact. But again, you're only doing it on the night of the 28th through the early morning of Thursday, the 29th, because you have to actually see the person in a place that they're going to be sleeping that night, as far as you can see. And the paper copies will be posted to our website either today, late this afternoon, or tomorrow morning. I'm just about finished with them, and so it's just a matter of working with our communications team to get those posted. So either late this afternoon or early tomorrow, you should be able to find those on our K-Count page. We are not able to necessarily to make printed copies for people. If that is a barrier for you for some reason, you can email me. I'll put my name in or my email in the chat after I switch over to Sarah, and you can email me and we can have a conversation about that. So give me just a moment real quick here. I'm just pausing for just a second, making sure I'm on the slide I want to be on. Okay, so before you start using the survey, you're going to want to make sure that you are familiar with the survey before you start conducting it. You don't want next week on the 28th to be the same, or the first time you actually take a look at the survey. Within the app itself, there are some instructions that tell you how to move through it. And so you want to familiarize yourself. And in the next several slides, we will actually show you how to download the app and what it looks like. And we want you to know that you can download it now and you can play around with it. And up until the day of the 28th, you can submit practice surveys that it's basically in a test mode or a practice mode, and it's intended for you to practice on. So you can do that using different variations of responses to see how the questions pop up depending on if people say yes or no, et cetera, et cetera. But essentially familiarize yourself with it. And then that's the same thing with the paper versions. They are nearly identical in the flow to the mobile app version, but there's a slight variation. So you just want to make sure you familiarize yourself with it, and then make sure that if you are coordinating volunteers or other staff, that they've had time to play around with the app or the paper copies if that's what they're going to use before they actually go out and start talking to folks.
Shay, we did have a question come through.
Will all counties be doing an unsheltered count and should expect to be out during the evening hours as well?
So that's a really good question. And the answer is it depends on whether or not there are homeless service providers and or volunteers that are able to cover every county. And so it depends means it depends on how many volunteers there are. There's always some counties that we don't have anyone going to necessarily that we're aware of. You can expect the majority of the counties historically have had people out on the same night, the night of the 28th or into the next day of the 29th, depending on what works for their communities. Kentucky Housing Corporation does not directly coordinate each county's efforts. We help provide the high-level training, and then those folks that are on the ground doing the work kind of decide what time works best for them. But if anyone is interested in a particular county and they're not sure what's happening in that county, you can email me. And again, let me just go ahead and drop my email in the chat while I'm talking, because I do have more slides before your turn, Sarah. But if you're interested in a particular county, please reach out to me and I can see if I'm aware of other people that I can hook you up with, or we could figure out how to get other people. So I do see another question. I'll just go ahead and answer it. The question is, can additional volunteers be recruited between now and January 28th? Will they be able to access this training in a recording? So the question is absolutely to both. We do the Balanced Estate K-Count. We do it a little bit differently than some other communities like a Lexington or Louisville might do it. In fact, I don't even think Louisville uses volunteers anymore. I think they just use homeless service providers. But because it's so spread out and there's just so many different levels of participation, we rely on local communities to recruit volunteers up until the last second. And however it makes the most sense to do so. We don't have like a portal that everybody has to sign in to at KHC, et cetera, et cetera. So definitely you can be recruiting volunteers until the moment you go out and do the count. And either later this afternoon or tomorrow, a recording of this training that we're doing right now will be available for people to access before they do the count. Yes, absolutely. Okay. So if you're using the paper version of the survey, the way that you can get it entered back into Counting Us is you can do it from the app itself on your phone or tablet, or you or someone else can go to their computer and type in the web address counting.us, and it will pull up the Counting Us platform, just like if you're on your phone, except it's not a vertical image, it's landscape, horizontal. I think it's actually more user-friendly on your phone than on your computer, but it still works. And then you would enter the information from the paper copy into Counting Us, either on your phone or on your computer. And it's really important to know that some of the questions are not in the exact same order as they are in the app. And so you just want to make sure you're paying attention, that you are transferring over the correct information to the correct question. Most things are in order, but there's just a little slight variation from getting it onto a piece of paper, essentially. Okay, I believe I have a few more slides here. So how does the Counting Us app work? Well, just like pretty much every other app you're going to have internet connection, so either Wi-Fi or cell phone service, in order to download the app on your phone or your tablet. And you will have to have cell phone service or Wi-Fi, so internet connection, in order to officially submit the surveys and to load them on your phone. And we'll talk about what that means in a little bit. But once it's downloaded on your phone or your tablet, you can use it even if you're offline, even if you don't have internet connection. That's part of the beauty of this particular app, is you can conduct the surveys out of internet availability, and then you essentially save them as drafts, which we will talk about, and then you will submit those drafts once you are back in range. And hopefully many of you all will not run into this as an issue and you'll have internet connection, but we do know there's so many rural areas out there where internet connection can be spotty. Your work will not be in vain. You will be able to conduct the survey and then submit it once you're back in internet range. So on your screen now, you should see some images of a phone, and this is telling you how you can download the app. This is what it would look like, and it's similar if you've used it before, but if this is your first time, essentially like any other kind of app, you're going to have to register. So you click the register button. It asks you for your name and email and just a few other pieces of information. Once you've done that, then it cycles you back to a screen asking you to choose a specific count. And you're doing this because there are dozens, if not hundreds, of communities that use the same Counting Us product. But we have one tailored just for us. And so when you click choose count, you will be prompted. It'll ask you to enter a setup key that your count administrator gave you. And that's me. I'm giving it to you now. And you can share it with others. It's not secret. It is KY 2026. And once you do that and click join count, your next page should show you 3 survey options: sheltered survey, observation, and unsheltered. And the top of your screen should say 2026. If you used Counting Us last year and you're just opening up your apps for the first time since last year, it's still loaded with 2025. Or if it was 2 years ago you did it, it probably is still showing 2024. So when you get to the shelter screen, you want to make sure that your survey, or excuse me, when you get your survey screen, you want to make sure that your surveys say 2026. And so if they don't say 2026, if they say a previous year, then you need to go back and join a new count. And I'll show you on the next slide some screenshots of what that looks like. But essentially, the setup key is the same that we just spoke about, KY 2026. So what does that look like? Instead of asking you to register because you've already registered, you're going to select on the first screen that pops up, change count, and then join new count. It's going to ask you for the setup key, KY 2026, join count. It'll tell you are now counting for 2026. It'll cycle you back around to the home screen where you will then select 2026, and it should then take you to the page that shows you your 3 survey options, and they should say 2026. But this is a really big deal to make sure you've got it set for 2026 before you start counting, because we don't want you doing last year's surveys because those won't count for this year. Okay, so I've already mentioned the Counting Us desktop version. That is counting.us. So I'm just going to move past that. Essentially, everything works the same way. You can set up an account from counting.us, log in with the key KY 2026, just the same. It just happens to be on your computer. So one thing that's really important is you want to get to this screen on the night of the count, or whenever you start doing the count on the 28th or after, while you're in internet connectivity, Wi-Fi or cell phone. This is called, once you get to this page, it's basically loading the surveys. And the reason I say do this on, again, like you can do it a million times between now and the 28th, but do it on the 28th as well before you go out in the field, because if we have made any edits to the surveys or anything like that, bringing up this screen essentially resets the surveys on your phone to work out of Wi-Fi. And this is essentially where you want to get it before you go out in the field. And hopefully that made sense. So, hang on. The reason I'm stopping is my slides aren't advancing the way I'm wanting them to. Okay. So getting started with the app, I've got a few more slides and then I'm going to turn it over to Sarah. So there are a few pieces of information you're going to want to know before you really get going with the person right in front of you that you're going to be speaking with. The first thing is, and the reason is because you're going to be prompted to make selections on the app. And the first one that you're going to be asked once you get in, and we've already seen these screens, is what survey type are you using? Because there's slight variations in the 3. Are you using a sheltered survey, which would be for ES and TH? Are you doing an unsheltered survey, or are you doing the observation form? So you've got to pick one of those 3, and we hope that you select correctly. The next piece of information that you will be asked is what kind of household are you interviewing? A household with just one person, or a household with more than one person? And then you will be asked to identify your location. If your location is turned on your app, I'm sure you're used to having to say yes or no to that, and we want you to say yes while using the app. If you have location services turned on for the Counting Us app, then GPS is going to go ahead and know where you are, and it's going to load a map and basically show you the map and ask you, is this where you are? If you don't have your location services on, then you are going to be asked to enter an address, which is obviously not ideal. You at a minimum will need a street name, the number if possible, but at least the street name, a city, and state. But again, that's why having your location on is going to be the best way to go. But just be prepared to know you've got to know those three pieces of information before you start asking one-on-one questions. Okay, so before you start interviewing the folks, you want to have a script or something to say in your own words to ask the person permission to ask them questions. And we have a sample script here for you. But again, you can put this in your own words. The most important thing is that you're going to introduce yourself, tell the person what you're doing, and ask their permission to participate. So I'm not going to read this to you now, but you can later once you get the slides, but you get the gist. It's essentially, hi, my name is Shay. I work with Kentucky Housing Corporation. You know, you would be telling them you're out talking to people about housing experiences as part of the K-Count survey. Can you have about 5 minutes of their time to ask them some questions? And I definitely summarize that, but you want to come up with something that works for you that you're comfortable saying. And now I'm going to turn it over to Sarah.
Thank you. Okay, so I'm going to talk about the app a little bit more and the actual survey in the app. So the first thing that you want to do before you even start with the surveys is you need to determine what survey you're going to be using. So like Shay said, there's 3 surveys. There's the unsheltered survey for when you are out and about and meeting people where they are and asking them the questions. There's the observation survey for when people may be asleep or maybe not a situation that you want to be in and talk to them. They may not be willing or able to answer your questions. And then the sheltered survey for when you have a shelter or transitional housing program that does not use HMIS. All right, and then step 2 is going to be choosing the language. So this survey is available in both English or Spanish. And then we want to choose the household type in step 3.
I'm sorry, I'm going too slow because I was trying to type in the chat at the same time, but okay, I'm
No, you're
focused.
fine. You
I'm
can
ready
also
for
tell
you,
me to slow
Sarah.
down.
No, you're doing good. Okay, choose household.
So you're going to want to choose the household type. So this is a question that you must ask the respondent. Even if there are other people around, you cannot assume that they are part of the same household. Please ask them if there are other people, this could be adults or children, that they consider to be part of their household or family that's sleeping in the same location of them that night. So this includes a question that we might want to ask that's something like, before we get started, can you tell me if there are any other folks that you consider to be part of your family that are sleeping in the same place as you tonight, or is it just you? This is one that you do kind of want to memorize something like this because you're not going to get a prompted question for that. This is the only part you're going to see about that is the individual or household where you choose either one. If they say it's just them, select individual. If they say that it's them plus anyone else that they consider to be part of their household, please select household. And this includes anyone that may not be related to them, but that they consider to be family. And so that's going to determine how many people, this is what's going to determine how many surveys you get. So if you select household, it's going to populate this other question that says, how many adults and children are there in this household who are sleeping in the same location on the night of the count? So ask them how many people, including themselves, will be sleeping in the same location. This one is going to be really, really important for determining how many surveys you do. So if they say, oh, it's them plus 3 children, and you put 4, that's going to give you the 4 surveys. And so that's going to determine how many you get. If a person says, oh, it's just me, and you had clicked on household, then that's okay. You just go back and select individual again, and it'll move forward. All right. If you are using the sheltered survey, you must select your organization name and the project name for the shelter or transitional housing program for which you're entering data. So this is very, very important. You must see the organization and project name in the list that drops down in order to enter data as sheltered. So if you select on organization or project and you do not see your ES or TH project listed, please, please, please tell KHC, please tell Shay, and she will have to put the shelter or transitional housing program in the list prior to the night of the count so that you can enter data. All right, so then we have the location. So Counting Us is going to ask you to allow it to use your location, which you do want to do that, at least while using the app. And that's highly recommended because it's going to help you determine where your location is without you having to manually go in and put the address every time. So that's going to really help with like pinging your phone and figuring out where you're at. Because in the next slide, you'll see that if you do have cell phone or Wi-Fi coverage when you're doing the survey, and you did select that your location was able to be accessed by Counting Us, then your phone will generate this handy dandy little map that will have a little pin of where it thinks you are. So if you look at the map and you look at the pin, you go, yep, that sounds about right, generally, then you'll hit next step. If you look at the pin and you say that is absolutely not even close to where I'm at, you can move the pin by just dragging it to where you want it to be on the map. Now let's say that you don't have cell phone or Wi-Fi coverage. It's not going to load a map. Instead, it's going to show this little pop-up that says unable to load map. Would you like to use your device's current location or enter the nearest address? And we do suggest that you select device location because all that's going to do is it's going to ping your phone and it'll use the literal location of it when you're doing the survey. Then if you have to enter a address, then this pop-up, like this screen, is what you're going to see. And it's going to ask for a street address, which we do want the street name. Obviously, if you're doing an unsheltered count or something like that, the street number is probably going to be hard to find. But if you have it, please use that. So like if you're talking to somebody who is spending the night at the post office lobby, then you can use that as the street address. And then we want your city and your state. And then you'll hit submit. And then we'll get to the actual questions of the survey. So the very first question is for you, the interviewer. This is not one that you ask the respondents, but it's in what Kentucky County is this survey being conducted? This is really important for our deduplication and for figuring out more of like a map of where people are being counted and how many people are in which area, that kind of stuff. And then have you been interviewed today already for the K count? This is going to be a yes, no. If they say, yeah, I've already been interviewed today, then we're done. We don't need to do the survey twice. So you'll just say yes and move on and hit submit, and that'll be the total survey. But if they say, oh no, nobody's talked to me about this yet, then you'll select no, and this is when the survey itself will like populate. All right, so then if it says no, you're going to get this additional question that's sleeping location on the unsheltered survey. So that sleeping location, where are you sleeping tonight? Or the night of the count. So if you're doing this a few days later, you're going to ask, where are you sleeping? Where did you sleep on Wednesday? And this is where you'll determine if the person was sleeping outside or in another place not meant for human habitation on the night of the count. This determines whether or not they are unsheltered. And if they are, so sleeping on the street, car, abandoned building, then the survey will continue and all the rest of the questions will start to populate.
And Sarah, I just want to jump in here and point out that the sleeping location question, where are you sleeping tonight, is not on the sheltered survey. In place of it, but actually earlier in the sequence of questions is where you select the name of the emergency shelter or transitional housing project. And the reason that is important is because if you are saying they're staying at such and such emergency shelter, when you on the survey, then it is attaching that person and their responses to the shelter. And so there's not a place that you say later where they're sleeping because they're already identified as sleeping in a shelter, but not just any shelter, the specific shelter by name, which is why we need that name of the shelter that's going to be participating before the count so that we can have it programmed in the app. And if you were to select sleeping location here on an unsheltered survey, emergency shelter is an option, but if emergency shelter is selected, the survey will end. It won't continue because it's assuming that the person is being counted separately in the sheltered count.
Okay, so then we move on to personal information. So this is going to ask, what is their first name, their initials, and if you can get their name, but at least try and get their initials. The only exception for this is if the person is in an emergency shelter or transitional housing, VSP, so victim service provider. If they are currently a victim service provider, we do not need their first name. And then it's going to ask, what is your sex? This is a required question. And that is going to have a drop down with answers of male, female, and client doesn't know or refuse, I believe. But an option 2 for this one, that there is a new question on this that is interviewer only. So this is not one that you're going to like ask. It's not an actual like question. But if the respondent, when you ask them, what is your sex? If they self-report a sex other than male or female, this is where you would write in their response in this blank write-in question here. And then we have, what is your birth, your date of birth, what's your age, and what age range do you fall into? Age range is also required. And so we really do suggest that you try and get the date of birth and their age because this will help us deduplicate people later. If people have the same name, same birthday, same location, we're going to assume that it's probably the same person. But it also helps us confirm their age range. So if somebody's date of birth was 2020 and they say their age is 6, and what age range do you fall into if you select 20 to 30, we're going to think that maybe that was a data entry error and not really the age range that they are. That kind of stuff.
And actually, if you answer in the app, so not on paper because it won't do it for you, but if you answer either date of birth or age, then the age range auto populates and you don't have to figure it out yourself. And age range is what we actually report to HUD, not the individual age or date of birth. But getting the date of birth and the age helps with deduplication. And when we use that word, what we mean is not counting people twice when we do the analysis on the back end. And it helps make sure, as Sarah was saying, that we get the correct age range information for the person.
All right, so then we move on to race and ethnicity. So this is also a required question. Just like most surveys, if you see something that has an asterisk next to the question, it is required. But so this is a select all that applies question. So HUD actually combined, I think it was last year or the year before, they actually combined race and ethnicity into a single question instead of being 2 separate ones. That way a person could select just Hispanic as their race, or they could select more than one. So this is a select all that applies, but there's also a write-in if they give you something that doesn't fit this. If they do say something like biracial, multiracial, mixed, something along those lines, Ask if they could specify which races, and that way you could select the multiple ones that they consider to be part of their multiracial identity. And then we move on to homelessness history. So these are the questions that are going to ask about their prior homelessness history, and it's going to help us determine whether somebody is chronically homeless, and some of that other information about like their prior situations. So the questions are going to ask, you're going to see 3 at the very beginning, and there are some that are conditional. They're going to show up depending on your answer to others. So the first 3 questions you're going to see is this the first time that you have been homeless? How many months have you been homeless this time? And in which Kentucky county or other state were you living in when you became homeless this time? So if you select no for is this the first time that you have been homeless, there's going to be 2 additional questions that pop up. It's going to be including this time, how many months have you stayed in shelters or on the streets during the last 3 years? And including this time, how many separate times have you been housed and then homeless again, where you've had to stay in emergency shelter or in the streets in the past 3 years? Has it been less than 4 times or more than 4 times? So I do want to note here, sorry, I've got like a frog in my throat. I do want to note here that for including this time, how many months have you stayed in shelters or on the street during the last 3 years is limited to the last 3 years. So if this person has been homeless on and off for the past 4 or 5 years, we're only going to count how many months they've been homeless in the past 3. And then the same thing goes for the how many times have they been housed and then homeless in the past 3 years. If they have been housed and then homeless 4 or 5 times over the past 5 years, but only 2 of them have occurred in the last 3 years, then that answer is going to be less than 4 times because it's going to be that 2. So that's a little bit of a qualifier just to like clarify there, that is part of the question is the last 3 years. Yeah. All right. So then disabling condition. You're going to see a little pop-up that says the next set of questions asks about sensitive topics. You do not have to answer any questions that you don't want to, but your feedback will help us improve services in the community. And you're going to see that all disabling conditions are yes or no, except for substance use, which requires you to ask if the use is alcohol, drug, or both. And so if the respondent answers yes to any of those top 3, so it's going to go through a few of the disabling conditions. So do you have a chronic health condition, such as lupus, multiple sclerosis, hepatitis? Do you have a mental health problem such as PTSD, schizophrenia, or bipolar disorder? Do you have a physical disability? If you answer yes to any of those top 3, then one additional question is going to pop up underneath of each of those that says, is this a long-term disability that impairs your ability to hold a job or live independently? And then it's going to go through questions about, do you have developmental disability such as cerebral palsy, autism, ADHD, or traumatic brain injury? Do you receive disability benefits, or do you have AIDS or an HIV-related illness?
Sarah, I messed up on the slides just a moment, so I'm just going to go back to show just real quick. The first one is about the substance use disorder. I kind of flew back past this one too fast. This is the one where if they say yes, you will then ask them to identify if it's alcohol, drug, or both, or if they don't know or don't want to tell you. And then the second one, which I had up longer, so you may have had a chance to see it, is the one that Sarah just went through. And then it shows the additional questions about if the issue is something that impairs your ability to hold a job or live independently. Okay.
All right, so now we have military service and employment. It's going to ask 2 questions about those. Have you ever served in the U.S. Armed Forces or ever been called into active duty as a member of the National Guard or as a reservist? Yes, no. And are you currently employed at a job for which you receive a paycheck? Yes or no. And then we're going to move on to domestic violence. So it's going to ask, are you a survivor of domestic violence? A note for this is that this domestic violence could have occurred at any point in the person's life. There is no, like, I guess expiration date's not the word I want to use, but it doesn't have to be like recent. It could be when they were a child and they're an adult now, and that still is considered yes. And then it's going to ask, are you currently experiencing homelessness because you are fleeing domestic violence, dating violence, sexual assault, or stalking? So if a respondent answers yes, that they are experiencing homelessness because they're currently fleeing domestic violence, then the survey will end for this person. There'll still be one more question for you, but you won't have to ask them any more questions for the survey. Now, if they say no, that they're not experiencing homelessness because they're fleeing domestic violence, then you're going to see this question about the causes of homelessness. So this is a chance for them to tell you their story of how they became homeless. So we do really suggest that you be patient and listen if they want to tell you. Some people might give you more information than you could ever ask for. Some people might not give you as much information, may not be as forthcoming. But we do suggest that you ask them this question of, in your own words, can you tell me what caused you to become homeless this time? And as they give you their story, as they talk, go ahead and select any of the answers that apply to that. And if you select other, you can be prompted to enter a reason. So if there's one that you don't see there, you can enter that. These were just the most common ones that we've seen over time. If they select natural disaster, so if they say that there's a natural disaster is the reason why they became homeless, then you'll have 3 additional questions that pop up to get a little bit more information about that. We do ask that you really try to get this information just because it is really helpful for us. So it's going to be the type of natural disaster. So this is going to be flood, fire, tornado, that kind of stuff. When did the disaster occur? And in which county did the natural disaster occur? All right, and then the last question in this survey is going to be just for you. This is not one that you're going to ask them, but it is the survey being completed directly in Accounting Us in real time, or is it information that's being entered from responses originally collected using a paper copy of the survey? There's no right or wrong answer. We don't care which way you did it. I mean, we do care, but we don't care in a negative way which way that you did it. We just want to know if you're using a paper copy, if you're doing it in real time. It helps us determine how people are doing this most frequently, and what options people are utilizing, essentially. All right, so now you have completed your first survey and you are ready to submit. You'll go ahead and hit Submit Survey, and you should get this pop-up that says Success. You've submitted this. It's successfully submitted. And that'll happen if you are in cell or Wi-Fi range. If you are not in cell or Wi-Fi range, you'll want to submit or save as a draft. Okay, so let's say that you have problems. Let's say that you hit submit and you get an error message like the one on the left. You can try again, or you can just go ahead and save it as draft and try again later. If you don't get an error message, but you're out of cell phone or Wi-Fi range, when you click submit, you may not get that like a success pop-up. It might stay the same. If that happens, just submit save draft and you can submit it later. All right, so now remember one of those first questions that we asked of how many people, including you, are staying with you tonight? This is why it's important, is because that number that you put in there is going to determine how many members of this household you're going to be answering these survey questions for. So where it says at the top, you're editing a household, you are on member 2 of 2. If you had selected 4 at the beginning, you would see you're on member 2 of 4, and it'll proceed like that. So you have to hit submit survey or save draft for the very first person that you're talking to, like for each person in the household. But then it'll prompt you to complete the questions for each additional household member separately. All right, so then The person that you're talking to can answer the questions about the other members of the household as well. So, especially if maybe the other household members aren't around right now, but they are planning to sleep there, that first person can answer questions for them. You do have to answer any of the questions, like I mentioned before, that have an asterisk next to them for the additional members of the household. So you do have to answer those mandatory ones. And those are the county where the survey is being conducted. Have you already taken this survey? Yes or no? Their sex, their age range, their race and ethnicity, and then the question for you, the interviewer, of whether or not you're entering this data in real time using the app or if you're entering it from a paper copy. So we do want you to gather as much personal information as possible, even if you really do just need to do the required questions for the other household members. We still want you to ask as many questions as possible because this helps us determine if people are being counted twice. It helps us get information that we do utilize, and that is really helpful for us. So for any additional member, though, of the household other than person one, you can skip the questions regarding their homelessness history if you want, but please, please, please do not skip these questions when you're talking to person one. That information is very, very valuable to us. And then for adults and any other unaccompanied minors, please collect as much of the other information as possible, especially relating to disabling condition, veteran status, and employment. All right, and then submitting your save drafts. So if you have been saving drafts and let's say you're out of range and you've had to save all of your stuff as drafts instead of being able to submit it, there is an icon at the bottom of your app that looks like a little mail slot that should have a little red bubble of how many drafts you have in your draft folder. And so if you open that up, and you select a draft. So when you select a draft, it turns that like orangish yellow that's circled there. Then you can select open at the bottom left, and it'll open up the draft as if you were taking the survey in real time. So you'll scroll all the way to the bottom and you'll click submit. And you'll get the little pop-up that says success, you submitted your survey. And then you can go back to your drafts and go to the next one and open and scroll down and submit until you don't have any more drafts in your folder. All right, and then I will pass it back to Shay.
All right, thank you so much, Sarah. And before I get into the rest of the slides, and I promise we don't have that many, I do just want to reiterate something we said earlier in case folks missed it. But you can go ahead and be practicing in the app, either on your phone, your tablet, or on your computer, as long as you've created a Counting Us account and joined the 2026 count. You can practice, including hitting submit up until the 28th. And then on the 28th, I will be resetting it to count mode. And so everything everybody did between now and then will go away and will not mess up any data for the official count. So we strongly encourage you to practice, do a survey or 2 or 3 for an individual, see how it works for household. That's what Sarah just went through when she was showing you household member 2 of 2. You'll kind of see how that flow works. See what happens if you select different types of sleeping situations on the unsheltered survey. See what happens if you select other, where it will prompt you to enter information, et cetera, et cetera. Play around with it. You can do it while you're watching TV at night, and it will not mess up anything. We want you to do that. But when is the deadline? So the deadline for submitting information, it's the same regardless of whether or not your agency uses HMIS or not, if you have an ES or TH project, or if you did the unsheltered count. But right now, I'm talking about the Counting Us surveys, so unsheltered as well as shelters that don't use HMIS. So the deadline is 1 week after the count, so February 4th, 2026 by 5 p.m. What does this mean? What's the deadline for? Well, the deadline is if you used paper copies or some of your colleagues did, and you're entering that information for them, you have 1 week to get that entered and submitted via Counting Us. And if you saved drafts in your account on Counting Us app, you have 1 week to go and look at that little red circle under drafts that Sarah showed you and make sure you submit them all so there's no longer any red circle with a number in your draft box. And you can reach out to me. My email address is on the screen. If you have any questions or concerns, sometimes people are unsure if they submitted something correctly. They can reach out to me and I can find their survey by looking up their username or email address and then finding the survey they have a question about. But we wait a week before we actually pull official numbers to give everybody time to get their data in. Because if we went and started pulling it on the 29th, there are people that we know don't have everything completed yet. And so those numbers would be inaccurate. But help us please get all the information done within 1 week. And then if you're using HMIS for your shelter or transitional housing project, the deadline is also the 4th. So you don't have to remember another date. Again, you will be submitting a report to us. And that report is for the people that are staying in your shelter on the night or transitional housing on the night of the 28th. And you are not just running a report and submitting it to us without looking at it, but you are making sure the person or persons that know who was actually in the program on the night of the count take a look at the report and that it makes sense and is correct. So an example would be, let's say y'all had 10 people in your shelter, but your report says 20, there's obviously a problem and that would be an overcount. And so what could have happened in that situation is 10 people that exited the week before were never exited by whoever does the HMIS data entry. And so that needs to be cleaned up before you send it to us, please. And then you will also need to complete your sub-assessments, and you'll want to actually do those on the night of the count or the next morning so that you have the information in case those people leave, but you have until the 4th to get it entered into HMIS. And again, the instructions for what I just said for HMIS can be found on our K-Count page of our website, and you can submit questions to the partner agency portal. And then just real quickly, I'm going to go through some tips from the field that have been collected over the years from folks that have done the count, the unsheltered count in particular. Some of the stuff, especially for those of you all who've done this before, it should be very familiar, and you could be sharing your own tips. And if you have any, feel free to put them in the chat. And we are getting towards the end. So if anybody has any questions they want to put in the chat, now's the time to do that. But I'll go ahead and just share some of these tips. Obviously, you're going to want to work with your local partners to identify known locations before the count. And so that way there's a plan of action for where you want to go on the night of the count, or if you're doing it early in the next morning. Recruit volunteers. You might recall there was a question earlier about, can we still be recruiting volunteers? Absolutely. And volunteers, you know, that could be people who are who work with people who are homeless. It could be people who don't. Maybe some college students, some social work students, for example, might be interested, churches, etc. But there's different ways for people to help. They could actually help conduct the count. We strongly encourage that you pair volunteers with people who work with people experiencing homelessness as part of their career, so that you have a professional as well as a volunteer on every team. But if there are volunteers that aren't interested in actually going out and talking to people, maybe they're interested in gathering and assembling donations and care packages. Something you could do in advance, depending on where you all are, is you can actually create maps by using Google Maps and print those out and hand those out to different teams to cover specific areas so people aren't moving or coming over on each other's area that they've already covered and potentially interviewing people more than once. As I mentioned, we want to make sure every team has at least one homeless service provider or perhaps someone from an emergency shelter that could be part of a team if possible. In some communities that might not be possible. It might just be all volunteers. But if you have that could be really helpful in engaging with folks. And then consider recruiting law enforcement to help. That might not make sense for your community, depending on your relationship with law enforcement. But there are a lot of law enforcement organizations across the country or across the state that are very much interested in working with people who are experiencing homelessness to help them connect to resources. Some of these departments even have their own social work staff, etc. But of course, if law enforcement is going to participate and they're actually going to go out in the field with you, we strongly encourage plainclothes officers and using cars without markings on it because we don't want to intimidate anybody or make people feel like this is an enforcement opportunity because it's certainly not intended to be that. And another piece of advice we have had and success is to work with your local health departments and hospitals. A lot of these organizations have wonderful outreach staff that are in the community a lot, working with people who are experiencing homelessness. And they have a lot of knowledge of where people might be, as well as access to some resources, including just information that could be helpful. And then make sure you plan on holding a training or a briefing with volunteers and staff before the count. It can be the same day, but that way you can make sure there's opportunity for people to ask questions, maybe do some role playing, some practicing. So you're not sending people out just completely cold. You can do some troubleshooting if necessary. You also want to make sure that if you're helping coordinate volunteers and staff, that everybody has relevant contact information for who they should contact if there is an emergency or a crisis. Obviously, 911 can be used, but if there's something that doesn't quite rise to that level of emergency, who can they contact on the team to help problem solve whatever the situation might be? Particularly if there might be a mental health crisis or some type of safety concern due to domestic violence. Do you have contact information for your local domestic violence service agency, your behavioral health care organization? If someone's interested in going to shelter, is there transportation that can be organized? Because we'd love to get people out of the cold and into shelter if possible. You can partner with your local EMTs, or at least let them know what you're up to that night, that they might be getting calls from you if there's situations. Hopefully that won't happen, but they can also be just useful, and they might have information for people they've engaged with on a regular basis that you could go find. And then if you are a county coordinator, meaning you're helping coordinate your area, consider giving out your contact information as a point of contact for who people can contact on that night and after the fact as well. And then this goes without saying, we know you know this already, but particularly for people who might be volunteering, this is their only time they've really engaged with people who are experiencing homelessness. Just remind folks that we need to be respectful of the spaces that you will be entering. It might seem like a public space or certainly not a home to you or me, but to the person that is sleeping there, it is their home, at least for the time being. And so we need to treat it that way. And make sure everyone understands the purpose and the mission of the K-Count. And it is, we talk a lot about reporting information to HUD because it's a requirement, but it is also a valuable piece of information for us to understand the needs of our community so we can make decisions on resources. And it is ultimately to help people who are experiencing homelessness and not to do any harm in any way. And we always want to treat people with respect and dignity, you know, provide care packages to anyone that you encounter, regardless of whether or not they agree to participate. We don't want to hold back donations just because someone was not interested in participating. If that happens, you can give them the care package or the donation, and then you can complete an observation survey. And then, of course, allow people to tell their story. Essentially, as much as possible, treat this as a conversation. It'll make it more comfortable for you and for them, but let them have time to tell their story of their experience if they're interested in doing so. And then because you've practiced with the survey, you know kind of how the survey flows. And when people are telling their story, oftentimes you can get the information to answer some of the questions that they've already answered without you asking. And then switching gears, so pay attention here for just a second. If you have, I just want to mention this, if you have an emergency shelter, transitional housing, rapid rehousing, or PSH project. So remember, rapid rehousing and PSH are not involved in the K count directly. But if you have those or ES or TH, we do need you to complete what is called a housing inventory count or HIC form for each of your projects. This is the same as we've done every year. The HIC is a companion to the point in time count that we have to submit to HUD. The point in time count is interested in people. The HIC is interested in resources and specifically beds and units dedicated to people experiencing homelessness. And we will have another webinar regarding the HIC next Monday, January 26th at 2 o'clock. The link for that will be in tomorrow's eGram. It was in last week's eGram as well. We'll get it on our website as soon as we can. But essentially, you will have 2 weeks to submit HIC forms to us, and it will be to the K-Count webpage listed on the website or listed on the slide here. But 2 weeks after the count is how long you have for the HIC. So plenty of time. And then lastly, these are the ways that you can get more information. If you're familiar with our help desk, which is now called the Partner Agency Portal, you can submit questions that way. You can contact me directly, or you can go to the K-Count page. That is where the slides from today, as well as the recording, as well as the paper copies of the surveys, as well as the information on how you download the app with the QR code and setup key of KY 2026 will be listed. All things K-Count and HIC can be found on our K-Count page. And I will, before we log off, I'll drop that link one more time in the chat. I'm going to attempt to do that while I'm talking, though my multitasking is not as good as it used to be. I think I've got it here. I just put it in the chat. But we will hang on here for just a few more minutes and see if anybody has any questions. You should be able to unmute yourself if you'd like to speak verbally or ask your question verbally, or you can type it in the chat, or you can email me or submit a question through the help desk. And if any of my KHC colleagues have anything that they think we should mention, feel free to chime in. Okay, well, it sounds like there aren't any questions, at least for the chat or for anybody wanting to unmute. So we will go ahead and wrap up. I want to thank again everybody for joining us today. And I know it can be a little bit confusing, especially if this is your first time. So please don't hesitate to reach out if you do have questions. There are no silly questions or anything like that. We very much appreciate your help and welcome your questions so we can provide you with the information you need. Otherwise, everybody stay warm out there and have a great rest of your day.